first, and it looks as though a lot of people are going to be losing their food stamps out there, their SNAP benefits. And it looks like a couple of federal courts have come in and said, no, they have to pay it. Some states have said, okay, we're going to go ahead and pay it out of state budgets. But I also heard, this is also a live Q&A. So what we're going to do is we're going to crowdsource as much information help as we possibly can. If you're new to my channel, my name is Ed Weir. I ran the third business Social Security office in the country. Before that, I worked for the Department of Welfare doing food stamps and Medicaid, and many, many decades ago, I was a sergeant in the Marine Corps. So, but I've also heard that some states are trying to fund food stamps, and the federal government has decided to turn off that entire system, the EBT system, so states can't even put money in there if they wanted to. So that's, wow, that's pretty nasty. But we're going to see what's going on here. But regardless of the fact, if they turn on the food benefits, the SNAP benefits today, tomorrow, whatever the case may be, there are still issues going forward. Billions are being cut back. You know, close to $1 trillion is being cut back from Medicaid. Billions are being cut back from food stamps. We've got the Affordable Care Act. People's prices for their premiums for the Affordable Care Act are going up 200-300%. Medicare is going to be cut by over $500 billion over the next few years. Social Security resources are being cut, people that help you out. So, but on the brighter side, the rich and corporations got trillions of dollars of tax cuts. So there's that. So, but the most vulnerable in America are paying for it. All right, so we've got a lot of questions, and we're going to go through systematically. So try to listen as long as you can, and I'm going to go through a whole bunch of different programs that might be able to help people out there. A lot of seniors receive food stamps, and they just might be without this month, next month, in the years coming forward. Or a lot of people on disability also receive food stamps. So let's go ahead and go down systematically, and all of our outstanding people on our regular, our community always helps out. Okay, so this is my website, one of the websites, mygovexpert.com, and we're going to go through this systematically. So if you dependent on food stamps, and obviously you're getting close to your full retirement age, or getting close to retirement, you can file for retirement benefits at 62 years old, and you're saying, well, I don't want Social Security benefits at 62 years old because I want to wait. But if you're in dire need now because of situation, you can file for retirement benefits now and then suspend those benefits or withdraw those benefits later. I talked about actually this, the retirement thing in a video I did, day before yesterday, the details on that. So that's one option some people out there are using. Disability. So disability benefits, if there's so many people that are eligible for disability benefits that are not receiving it because they don't know the process and stuff. When you file for Social Security disability, you essentially file for two different programs. It's called SSI and SSDI. And the reason I'm making this difference is if you've got young people out there, that are disabled and they're said, well, I can't file for Social Security disability because I don't have the 10 years required to receive Social Security. Doesn't matter in terms of disability benefits. When you're younger, if you become disabled, you don't necessarily need the full 10 years of paying into Social Security under what's called the SSDI program, Social Security Disability Insurance. But there's another program called SSI, and there's a lot of people eligible for this that are not getting it. SSI is not Social Security income. Everybody thinks it's SSI is Social Security income. No, it's called Supplemental Security Income. It is a welfare-based program. That means it's low income. You have to have low income, low resources, and you either have to be disabled or 65 and older. With SS for this year, the max you can get is $967. For 2026, they changed it. It's $994 for 2026. If you're a couple receiving SSI, up to $1,491. So SSI is Supplemental Security Income. Low income, low resources, disabled, or 65 and older. And anytime you file for Social Security disability benefits, they always address both programs as what They call it inside. Title II and Title 16. Title II is the SSDI. Title 16 is SSI. Title 16, the Social Security Act. I don't want to bore you too much with it. The inside baseball. But those programs are available, SSDI and SSI if you're disabled. Okay, what else is out there? Again, we're going to go through the entire list here, and there's always a lot of people saying, yes, we know about the food banks. There are food banks in your particular area. I'm sure there are food banks. Hopefully there's food banks in your area. I don't think they're going to be able to hold up this month or in the coming years with all the cutbacks on everything. All right, what else we got out there that you might be eligible for? Remember, our community, what we do in this community is, you listen for yourself to make sure you're squared away, as we used to say in the Marine Corps. You're all set in terms of the benefits you're getting the right check at the right time, and you're taking advantage of all the programs that you paid for that are available for your particular situation. But our community always looks out for everybody else around them. So they take this information and talk to other people in their community and their relatives, friends. The waitress that works at the gas station says, hey, I know your daughter is struggling. Your daughter's, kind of sick and, disabled. Have you applied for SSI? Have you applied for SSDI? All this other stuff. So go out into your community and help as many people as you possibly can with this information. And if you have any particular questions, that's what you do. You come back here during the live Q&A, so make sure you subscribe, or you record a video question, and I'll show you how to do that later. I've got some video questions here. Okay, so if you are 60 years old, 60, you're eligible for survivor benefits. If you were ever married to anybody, and this is what a lot of people make mistakes on, they say, you had to be married 10 years. No. For survivor benefits, no. If you were divorced, yes, 10 years. But if you were married to that person when they passed away, you only had to be married to that person for 9 months. There is actually exceptions. That's one of the problems with Social Security. Congress has built so many exceptions to the exceptions that it's over 20,000 pages of policy. And that's why so many people are losing benefits, because they don't know about them. The exception is if you had to be married to that person for 9 months, or if it's less than 9 months, that person passed away by accident or was in the military. So those are exceptions. So survivor benefits start at 60 years old, except for what's called, another thing, probably hundreds of thousands of people out there that are eligible for these benefits that don't get them. It's called disabled widows benefits. But if you're between 50 and 59 and you are a disabled widower, Social Security calls it surviving spouse, then you're eligible for benefits on that person's record. So there's a lot of people out there, probably some in your community, someone you know, or someone you tell someone about that, and they know someone that knows someone, so was it 7 Degrees of Kevin Bacon type situation? That's what we're looking for here. So if you know someone that was married to someone and they passed away, and they're between 50 and 59, they're disabled, they're sitting around there, well, I can't file for disability benefits because I never worked. I was a stay-at-home parent, mother or father or whatever the case may be, so I can't get disability benefits. Wrong. Number one, just might be able to get SSI. Don't have to be insured. Number two, you were married to someone and you might be able to get disabled as widow benefits. So let's go out there and see. And then if we get people, for the new people here, we get people all the time that come into our live chat and go into the video questions after and say, yeah, I just found someone down the street that found some money. So we called up Social Security, or we called up Department of Welfare and Medicaid, and we got that person money, and say, oh, they're so happy. I got a free lunch out of it and stuff like that. So we love that. So, and we love when you tell us that. So please. Okay, family benefits. So family benefits encompasses a lot. So if you were married to someone for 10 years, again, if that person is still out there alive and kicking, you had to be married for a divorce type situation for 10 years. So spouses, if your spouse is currently receiving retirement benefits and you're 62 years old, you can receive benefits on that person's record. There's a calculation that has to be made first. Ex-spouses, divorced spouses, again, we already talked about surviving spouses. Children, if you have a child and that one of the parents is receiving disability benefits or retirement benefits, that child is eligible for benefits on that person's record. Again, you can go onto my website, mygovexpert.com. Sorry, it's not showing the top part. There's the top of it right there, my Social Security, mygovexpert.com. And you just go in there and let me pull this down a little bit, and you click on the Social Security part, and it goes retirement, disability, survivor, SSI, Medicare, and then we'll get into living on Social Security alone and all the other information it has. It's all 100% free, so use it and share it. All right, so for family benefits, we're talking spouse benefits there. We're talking divorce spouse benefits, independently entitled divorce spouse benefits. A lot of people miss this one. This is people are sitting out there waiting for benefits from a divorced spouse, but they're saying, I can't file for benefits on a divorced spouse because they haven't started benefits yet. Incorrect. As long as they're 62 years old, you can file for benefits on their record. And I've got the Social Security reference down there because a lot of Social Security employees, unfortunately, the people at the front windows tell people the incorrect information all the time. So I had to put the Social Security reference right there. Child benefits. Here's the child benefits. Again, if you're under the age of 18, you can get benefits on a parent's record. And here's a question that a lot of people ask, what about grandchildren? Because there's a lot of people out there, grandparents thought they were done raising kids, but you know, life is what happens while you're making other plans. You have to take care of a grandchild. Grandchildren can receive benefits. Hey, if you need help with Medicare, Medicare Advantage, Medicare supplements, Part D plans, make sure you reach out to my partners at Chapter of Medicare. I looked for a place that would help y'all out, and Chapter of Medicare knocked it out of the park. They've got excellent customer service. They look at every single plan in your area, and their help is always 100% free. Give them a call, and they'll see if they can help you out, and tell them Dr. Ed said hi. From your record, if you're a grandparent receiving retirement benefits or disability benefits, that grandchild can receive benefits from your record if you adopt them, or if their parents are deceased or disabled. So let's get that word out there. So you have to adopt the child, or again, the parents are deceased or disabled. And so the child will get benefits up until the age of 18 years old, or until they graduate high school. It used to be until you graduate college, but now it's until you graduate high school, or 19 and 2 months. And then if the child is disabled, there's a thing called Disabled Adult Child Benefits, DAC benefits. So if the child became disabled before the age of 22, then the child can continue to receive benefits for the rest of their life as long as they're disabled. Okay. All right. So, and then also got a section in there about SSI, supplemental security income, and all the other how to apply and work and avoiding problems, the different state variations, and so all of the rest of it there. Okay. Let's get into Medicaid. So Medicaid is going to be cut back substantially as well, about $1 trillion. And, you know, there's people passing in misinformation. Oh, we're only kicking illegals off of, you know, food stamps or, you know, Medicaid. And I'm here to tell you, people that believe that, they want to believe that. You can't tell them otherwise. But the reality is, if you're not in this country legally, you're not getting Social Security retirement benefits, disability benefits, SSI, Medicaid, food stamps. Yeah, it's not happening. So unless, yes, people will say, well, when people go to an emergency, yeah, well, they're not paying that person, they're paying the hospital. So the hospital doesn't take the hit of most of what the hospital, they take the hit on uninsured patients is American citizens going into a hospital and not being insured. So the government and their states kind of reimburse the hospitals for that uncompensated care. And a small percentage of those are people that go in there that are not in the country legally. That's the only way, but it's really reimbursing the hospitals other than necessarily. Anyway, so yeah, but people want to believe misinformation. You can't. It's kind of like a warm sweater that sometimes you got a sweater and it's got one little thread there that's loose, but if you pull that thread, the whole thing unravels. That's kind of the idea. They say they probably understand that, you know, people that are not in this country legally don't get benefits, but they don't want to pull that string because, yeah, so that's just a situation we have to deal with. All right, but if Medicaid, and this is one of the reasons we built this our new website also, is what's going to happen in the future with close to $1 trillion being cut out of Medicaid, and bunch of money being cut out of food stamps, a bunch of money being cut out of Section 8 housing. There's going to be a 2-year limit on Section 8 vouchers for some people. It's going to get more and more difficult. So we needed a crowdsource. We needed a place for people to get together and help each other out. So that's exactly what we did. We started a brand new hub, a brand new discussion forum, area24help.org, where you can go in there. So please register. We didn't anticipate it to help immediately. Well, it can, but we just started it, and then this food stamp crisis happened, and so we need as many people in preparation for when the one big beautiful bill starts rolling downhill and all this stuff starts happening across the board. So please register. It's 100% free. We don't spam you with a bunch of garbage, but it's a discussion forum. So if you're in a particular area and you're having a problem with the local Social Security office, with a local food stamps office or Medicaid, you want to find out how to file an application, why you were denied, all that kind of stuff, this is a place where people can talk and help each other out. That's the most important thing. But the important thing is we need people there to help out. So please register. I'd appreciate it. So. All right. So in terms of Medicaid, that is a welfare-based program as well, means low income, low resources. Usually in most states, you apply for Medicaid and food stamps at the same place. So I'm sure people that applied for food stamps, they also took an application for Medicaid. They're supposed to address both programs. And someone in the questions before we even started today, someone said they received notice that they got some money put on their food stamp card, their SNAP card. It was only partial. Okay, here it is. Right. Last night I received a message that I would receive 25% of the $102 I received in benefits. Well, that amount on my SNAP card is 44. That's not 25% of 102. I'm grateful, but they are lying. Okay. Yeah. Has anybody else received partial in there? I've seen some places, again, that's mentioned that, again, they're still trying to work it through the courts, even though in September on the Department of Agriculture website, they said they can use that emergency fund, that $5 or $6 billion. They can use it during a government shutdown. But then they took that off the website, and then they said, oh, we can't use it because of yada, yada, yada. So that never seemed to stop this administration. And someone said, well, if we stop giving money to foreign countries, then we'll have money for himself. We did. So that old lie, that old chestnut is kind of thrown out the window now, right? They've been saying that for decades. Well, as long as if we stop giving money to foreign countries, then we can take care of American citizens. Well, we did. They shut off USAID and we stopped giving money to foreign countries. And guess what? They still cut Medicaid and food stamps and Section 8 housing and Medicare. So yeah, so that'll, and then they also, beyond that, they even found $40 billion to help out their buddies in Argentina so the guy could win the election and some guy that used to work at Goldman Sachs allegedly could recoup his investment. So yeah, so that whole thing is. All right, so Medicaid. Medicaid, same type thing in food stamps, the Affordable Care Act, the advanced premium tax credits that people are receiving on the Affordable Care Act, those are going to be going away substantially. So a lot of people are going to have a lot of difficulty there. So in terms of health insurance, you have the Affordable Care Act, you have Medicaid, Medicare. For Medicare, you get that at 65 years old, unless you're disabled. If you're disabled, SSDI. You cannot get Medicare from being on SSI. You have to be on SSDI. So once you're on SSDI for 24 months, then you're eligible for Medicare at the 25th month. And what a lot of people don't realize is people on Medicare can also receive Medicaid. So there's a lot of things out there that people say, well, I'm receiving this. Okay, fine, but you also know you can receive this. You know, one person can receive retirement benefits on their own records, benefits as a spouse or divorced spouse from somebody else's record, or they can be receiving disability benefits and benefits from another record. They can be receiving Medicare because of it, and also Medicaid, and then also get one of those Medicare Advantage dual eligible plans with the grocery cards and the over-the-counter cards, and also get the low-income subsidy, which is the extra help with prescription drugs and potentially food stamps. Well, if you're getting those, it depends how much you're getting. So yeah, there's 4 or 5 or 6 or 7, and then also possibly Section 8 housing. Section 8 housing under the one big beautiful bill, what are the cuts? About 43% to HUD. So that's going to be difficult for a lot of people out there, is getting oh. All right. So many times we saw carts full of junk food loaded up in the ream, all snap. Yeah. Again, people love junk food. So yeah, we're not going to judge people what they buy. And again, that's people, they don't want to help other people. So they look at anecdotal evidence to say, well, I knew a guy that knew a guy that knew a guy that, was getting benefits fraudulently or whatever the case may be. And so therefore, let's throw the whole thing out in the bathwater. So they don't take that same logic other places. So they say, well, I'm an old Marine Corps sergeant. So Department of Defense, if you want to look at fraud, waste, and abuse, you should start at the Department of Defense. They haven't passed an audit in over a decade. Well, I have to be correct here. There's one part of the military that did pass an audit. And I'll give you 3 guesses, and the first 2 I'm not going to count. Guess what? The Marine Corps actually passed their financial audit, but everybody else over the last decade or so didn't pass their financial audits. It's been estimated billions of billions of billions of billions. 10% of the Department of Defense budget is fraud, waste, and abuse. So when are we going to shut down the Marine Corps? When are we going to shut down the Air Force? When are we going to shut down the Army, the National Guard, the Space Force, or whatever they call it? Yeah, nobody's asking to do that. People speed on the highway. So we're going to shut down the highways? The billions, perhaps trillion dollars that the banking industry, Wall Street, ripped us off during the housing crisis, where they manipulated bonds and leveraging and all that kind of stuff. And we're going to shut down Wall Street and shut down Goldman Sachs and all those other companies. Yeah, so fraud, waste, and abuse happens, yes. But the money that goes to poor people, predominantly to poor people that are, struggling, that's the first thing we're like, okay, well, I saw a case of this, and therefore let's just throw everything out. They don't apply that to everything else. It's because they just, again, it's, divisive and full of hate. I'm on Social Security. Am I eligible to get an EBT card? It's hard to paying bills, and I can't buy food. Absolutely. It depends on how much you're receiving from Social Security. But number one, Lily, I think I've seen you here before, so if you've watched my videos, so hopefully in terms of Social Security, you checked out, you listened to my videos, and you asked questions, and you made sure your current check is correct. You're getting all the benefits you're eligible for from Social Security, divorce, spouse benefits, surviving, retirement. Your retirement check is correct and everything like that. So hopefully we're all squared away there. But yeah, if you're having a hard time buying food, absolutely. That's what these agencies are there for, is to help you get your benefits. And that's the issue going forward, is bureaucratic disenrollment or bureaucratic barriers that are built into the One Beautiful Bill and have been built in for the past few decades. All of these hurdles to prevent you from getting the benefits you're eligible for and you need. And that's one of the major reasons we came up with our website, 24help.org, is when they start putting out these barriers and these roadblocks for people around you, your friends and family, to prevent them from getting their Medicaid or continuing to get their Medicaid or get their food stamps or get their Section 8 housing or get their Social Security disability or whatever the case may be. When they put up those roadblocks, those people come to us for help. And then they come to this channel. I'm going to be here pretty much every day for the next 10, 20 years, hopefully. And the 24help.org is to help, for help, 24/7. So to help you and for help, for people to help and for help. So, but in terms, file and ask them, say, what's the threshold in my particular state? Because each state is a little bit different. What is the threshold in your particular state for receiving benefits? And they will tell you, hopefully they will tell you. And then if you're denied for whatever reason and you're under that threshold, then you appeal. That's one of the big reasons people are struggling out there, is because they don't fight the system. They get a letter in the mail and they don't understand it. It's all in, bureaucratic English. And people don't understand it, and they think, well, I guess I'm not eligible. I'm not entitled. I can't get it. Okay, I guess that's it. I'll go have some cat food or whatever. No, fight it. If you think you're eligible, or if you don't know you're eligible, check. Come over here, go to 24help.org, ask someone else in the community, and someone else is out there is going to help you out. Again, we need massive amount of people to help each other out. So please, please, please. So it's going to take us a while to build up a community on that. We've got 600,000 subscribers to this channel. So if we get those 600,000 to start helping people, then I think, we'll be nice and set. So, but Lily, definitely, what else we got there? Food banks, obviously, 211 in your particular town. They've got resources that you can find. And if you have a Medicare Advantage plan, then some of those have OTC cards, grocery cards in them. Unfortunately, a lot of those are kind of disappearing.